Welcome to the latest in our series of TopMedTalks 2. In these podcasts, the TopMedTalk team is in conversation with global thought leaders in perioperative care. TopMedTalk. So hi, I'm Monty, Mythen, Editor-in-Chief of TopMedTalk. I'm here at the 7th Annual World Patient Safety, Science and Technology Summit in Huntington Beach in Southern California. Enormous privilege to just been joined at short notice by Joe Kiani, if I may, Joe.
Yes.
Welcome to the table. A brief sort of summary. The founder of Masimo is how I know you in the past, and more recently, the Patient Safety Movement Foundation and Coalition, if I've badged it correctly. And so, by default, this wonderful summit, and shame on me, it's the 7th summit. I've noticed it every time, and it's the first time that I've made it here. We're also joined by Desiree Chappell, the US anchor for TopMedTalk. And we've just been doing a bit of informal chat. Your first time here as well, Desiree?
It is my first time, yeah. And just really excited to be here and enjoying all the presentations and the patient interaction. I love that aspect of it. And it's just been a well-thought-out meeting and well-executed. And it's beautiful and a wonderful experience so far.
Thank you.
It's
so nice to have you.
You've done a wonderful
come.
job. Yeah.
Thank you. Thank you so much for coming. Hopefully better late than never, and from here on with us.
Well, we're looking forward to travelling that journey. If I may, very briefly, Joe the man. It's up. You can look it up on Wikipedia. So I did. Okay, we seem to be kindred spirits. You're a migrant. Your father is an engineer. Your mother was a nurse, and so I've got the same CV to that point. And then,
Is that right?
and you're obviously younger than me. Everyone can tell that.
But you got into medical school.
Okay, so then our paths diverged. But you did really cool. You became an electrical engineer, getting 2 qualifications by the age of 22, relatively locally. My question there is that still a good qualification? Because one of my 4 children, who's a girl, is doing engineering. Is it a good choice?
It's even a better choice these days than when I studied engineering. And in fact, I was in college for pre-med, and I was really bad in chemistry. Fortunately, at the same time, I was really good at physics, so I said, maybe I'm in the wrong path.
We're obviously twins separated at birth. Yeah. I nearly failed because of the chemistry, but the physics was just like, what's the problem?
Why didn't you go with it like I did?
I asked. That's why I'm sitting here twiddling knobs on a sound desk, and you're running one of the most successful corporations in the world.
Thank you. But yes, have your daughter go into engineering. It is an amazing profession.
That's a great
electrical
choice.
engineering.
Electrical.
Yeah.
Well, she's actually at the moment doing aerospace engineering, but she's thinking about where.
No. Have her come back to us. More general. She can get involved in aerospace if she wants to, but electrical engineering will let her get involved in anything, including medical technology.
There you go.
Now, we know your company, Masimo, because globally recognized brand, and particularly got to know it from the pulse oximeter. Now, correct me if I'm wrong, I don't think you invented the pulse oximeter. You just made it a lot better.
Yes, that's correct. We did not invent it, but we made it work through motion and low perfusion, which were the bane of pulse oximetry.
Absolutely. Yeah. And how long ago was that now?
The invention happened in 91, but we didn't get it to the market till 1996 in Europe and Japan, and 1998 in the U.S. And what's been great about it, as you know, with pulse oximetry, the early studies, when they did outcome studies, showed no difference.
Yes.
There was a big study with 20,000 patients, 10,000 with pulse ox, 10,000 without, no difference. Because we solved the motion problem on low perfusion, now the outcome studies are coming out to show that pulse ox makes a difference.
Yes.
Reducing retinopathy prematurity, detecting CCHD in newborns, and saving lives in the post-surgical ward.
And we've had lots of discussions about this on TopMedTalk. It's not all about just necessarily keeping the oxygen levels up. It's sometimes keeping them down to the right levels.
That's right.
Well, the subtle tuning.
The baby in the fetus is the fetus in the womb is sitting at about 35-40% saturation. So when you bring them out as a neonate too early, and you give them 100%, it's damaging to them, including their retina. And, of course, you can get oxygen toxicity as an adult, too. So, yes. You want to get it just right, not too high, not too low.
So on getting it just right, this whole patient safety movement, I mean, people have heard about patient safety, but I'm not sure everyone's heard enough about this whole movement. It's your. We've just been talking about babies. As far as I can tell, it's your baby. Is that right? You're the creator
correct.
of this endeavor.
Yeah, obviously there's been an amazing group of people working on patient safety for a long time. But I was shocked that after 10 years since the IOM report that showed 100,000 lives were being lost, in 2011 a report came from Medicare, which is a U.S. payment system for elderly, which is about half the patients in a hospital, and they showed 200,000 deaths per year or major harm. And that really made me feel like, okay, patient safety is no longer your responsibility or your responsibility, it's also mine. And I should do something about it. So, yes, I started the patient safety movement with the idea of creating a commitment-based model. Shamelessly took it from the Clinton Global Initiative. and also, as an entrepreneur, an engineer, dealing with it in a way that I thought it could be dealt with.
So we're hearing from Omar Ishraq earlier on today, who's a senior officer in your company. His roles again, are there?
He is actually my competitor.
I was going to say, I think that's
yes,
right.
And that's the beauty of this movement.
I'm tracking now. I was not concentrating. Yes. I'm thinking, how do you have two CEOs and two chairmen?
No, he's the chairman and CEO of Medtronic.
Yes.
I'm the chairman and CEO of Masimo, and we are in one area fierce competitors, but when it comes to patient safety, you're in it together. We're in it together.
Because he was thanking you in the talk earlier on today, and I wrote down a quote here: "When Joe decides to do something, it gets done." Yeah. So couldn't pop over and help us with Brexit, could you? Anyway,
for something completely different.
I know you're under pressure to get back to the meetings for more exciting sessions kicking off, but you've been talking here about this planning for zero. And the hashtag is EXO2020, and I think I see it on your...
I know this on Mike Ramsey's collar,
we covet those now. Yeah. Tell us a bit more about that.
Well, I think what's been missing is a sense of urgency with patient safety. And it's something that meetings would be had, talking about the future, talking about the history, but never about the present, it felt like. So we wanted to put a stake in the ground and say, we got to get to zero. I wish I could say it now, but give ourselves enough time that it was plausible.
Yes.
And work towards that, work backwards. What do we have to do? We have to unify as a medical healthcare community. We have to figure out what's killing people and find out if there's a solution for it. And if there is, which there are, based on evidence that some of them are 20 years old, come up with checklists or recipes. We call them apps, actionable patient safety solutions. And then, most importantly, ask hospitals to commit to implementing them.
And you gave out some awards today for people who've managed full implementation. There were 2 awards this morning, 5-star awards for people saying, well done, you've done it. And that means we can all do it, doesn't it?
That's right. And that's what's beautiful. Look, we've got over 4,700 dedicated hospitals trying to do it worldwide now in 50 countries. But of those, 4 are doing it all. Yeah. And they've shown that they can do it all. Everyone always says, well, we can't have too many initiatives. Yeah. These are not initiatives. These are standard operating procedures that need to be put in place for any place that's going to put an H in front of their building and care for patients. Yeah.
And when you look down the list, there's 18 of them there. The latest one, I think, is the one we're about to discuss shortly this afternoon, is post-operative delirium, which is on everyone's. But there's also mental health in there, for example. Is that right?
Yes, that's correct.
Which is a big challenge. Yeah. So we're all behind you for the Zero by 2020. Now, globally, as we talked about Mike Ramsey earlier, that's a big challenge to get it done by next year. But we could at least all agree to have zero tolerance of this carrying on.
Or agree to at least let's go implement all the processes we know that can work, yes.
Yeah. That would be often talked about as the greatest innovation of healthcare, is if we just do what we know works today. Yes. That would be a big innovation. Any other big messages for us? We know you've got to run back to the main session.
Well, thank you so much for coming. My closing thoughts to your listeners: if you're in a hospital, don't hope for zero, plan for zero.
Plan for zero. Desiree, plan for zero?
Yeah, absolutely. Since we've been talking about all this, I've been changing my own practice. And I think that hearing your passion and all the people that you have here will help. It helps move the needle, and I think we all need to hear this message. So thank you so much for everything that you do.
Thank you, Desiree.
Your team is saying you've got to go.
Gotta
You're
go.
so generous with your time.
Thank you so much. Thank you for having me, Monty. Thank you. Congratulations on your work. Thank you.
Nick Majerison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out TopMedTalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. TopMedTalk.com and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.